My name is Susan Tokeles. I'm a registered nurse. I am the compliance director at Central Florida Quality Care. We're located in Orlando, Florida, and we serve a 3-county district, Seminole, Orange, and Osceola counties. We're a full-line home health company. We have nursing, physical therapy, occupational therapy, speech therapy, and home health aides. I've been with the agency since day one. We got our initial start 4 years ago in home health. Prior to that, they did staffing. I came aboard when we started home health. We've used Alora in all its capacities since we started. When we first started, we only used it for our billing and our payroll. And as we've grown, so has Alora. In my previous work history, I've used both of the other major software providers for home health, and I found that Alora is much more user-friendly, and it gives us a better grip on our patient load and all facets of our work. I'll tell you how user-friendly Alora is. Miss Ann is 80 years old. We taught her how to use Alora.
She taught me how to breathe in and out.
No, we taught her how to use Alora. Yeah. That's how user-friendly it is. Before I became a nurse, my previous degree was in engineering. I did software design and engineering for insurance companies, workers' comp in particular. So I have a lot of medical background, and also for a company that designed interfaces for Palmetto GBA, which is the Medicare handler for this region. So I know quite a bit about software, and I know a little bit about medical software. And that's why I found that Alora is a good product for us in this industry. We were using something else in the beginning for a very short period of time. And we tried, the other companies will give you free demos. And we tried 4 different products, and we went with Alora. When the government said that medical records needed to go paperless, it had a big impact on home health. And of course they put that deadline off, but we wanted to be in compliance. So we worked with Alora in getting all of our clinicians onto the system to do all their notes, their evals, their plans of care on the computer. All our OASIS evals for nursing, our physical therapy, occupational therapy, speech therapy, and our social workers do all their notes and their admissions on Alora. Everything integrates. We can send it all to the doctors and insurance companies immediately. We know where our paperwork is all the time. It gives us a much better grasp of our patients and our care. This is the Alora dashboard that I was speaking about, and it has the areas for the 485s that are due, caregiver credentials due, our current census by payer, orders that are not sent, 485s that we're waiting for back from the doctors. We use everything that Alora has. We use it for our claims processing, we use it for billing. As I said, we use it for our notes, we schedule our nurses. We use the in-house Alora mail. My favorite thing that they've put on within the past 18 months is the EHR, the electronic health record. In the past, you go out to the patient's house, they still have to sign consents and authorizations and HIPAA releases on paper. Well, now we can scan them in and attach them to each patient's file, so we can look at that patient record and find all these paper documents and reproduce them if needed, and we don't have to have a lot of paper storage anymore. Lab results that come in from the hospitals are immediately attached to the patient's record. It's a marvelous system for coordination of care. Another important feature that I forgot to mention is that if you look at this board here where I have my trainings up here, Alora also has an area where you can integrate your records of your employees, and it gives me on the Alora dashboard an update of who has what coming up for renewal, like who needs their new CPR, who needs their new HIV training, whatever trainings are due for a person, if their driver's license or their insurance, car insurance needs updating. Also, the dashboard feature tells me what documents are late coming back from the doctors, which is very important in home health. Alora is the only company where I have the director's cell phone number. I can get a hold of somebody at Alora anytime I need them. I get excellent customer service from them. We've gone from having 1 user license when we first started to 2 to 5 to 10. We now have 80 licenses for Alora. All our people use it. All our clinicians use it. And everybody that has a problem, they can call Alora directly if they have problems with their hardware, installing Alora, or questions. They can get through to customer service every day of the week and get answers that they need. Alora can be installed on any system. We have some clinicians that use it on their iPads, other people use it on their tablets, their laptops, their desktops at home. It's very portable, and it has features where the notes can be done online and offline, which is something not all software companies offer. We've also gone through our initial survey and state surveys with Alora, state inspectors or your ACA people that come in, and they found that they can find what they need immediately in Alora. We have no questions. All of our documents are right there. Not only would I recommend it to other agencies, I have recommended it to other agencies. And at conferences, I do speak highly of Alora because of its simplicity to use, the customer service that we get, and the features that it has. That is a very, very important part. It makes my job so much easier as a compliance director.